Hello, good afternoon, everyone. We're starting the webinar. Welcome, everyone. A warm welcome to this webinar on health prevention for accelerating emission reductions at every source, review of the National Emission Reductions Commitments Directive, the NECD. My name is Anne Stauffer. I'm Deputy Director at HEAL, the Health and Environment Alliance, and it's my pleasure to have all of you here today gathered on this topic, and also my pleasure to have four excellent and distinguished speakers to help us shed some light. And actually, it's a special occasion. It's also a special day today, since it's 1 year after the entry into force of the EU's Ambient Quality Directive, which is really a milestone for public health and has a great potential. But it's also the first time we have the opportunity to exchange on reducing emissions of air pollutants after the EU Commission has published their assessment of the NEC directive. And I'm pleased to have Bettina Kretschmer here with us this afternoon to shed some light on this. Today's webinar is the third in a webinar series that HEAL is organizing this autumn on reducing costs from air pollution and strengthening pollution. And we considered it important to talk about this aspect because poor air quality, unfortunately, continues to be the top environmental threat to people's health in the European Union, leading to thousands of premature deaths and hundreds of euros of costs annually. There is no safe level of air pollution, as we know from the large and robust body of science that's available, and the impacts and costs of air pollution are actually largely preventable. The EU's National Emission Reduction Commitments Directive, the NECD, sets national reduction commitments and monitoring obligations for key air pollutants that have a significant much more to reduce emissions, and that ammonia, methane, and biomass burning stand out and were identified as key issues. So we'll also be talking further in today's webinar on specifically the emissions of these and the concerns around these pollutants. HEAL also, did a position and gave some expert opinion as part of the review, and we identified that there are unfortunately major gaps in the current NEC, in particular when it comes to complying for member states with ammonia emission reductions, or also coherence with the EU legal framework, and also loopholes that we're seeing in reducing obligations for methane emission, which is a precursor for ozone. And again, we'll hear more and shed some more light on this issue today. So the main questions we want to tackle today are: what are the NECD implementation gaps, and what is also the result? What is the results of the review that the Commission has undertaken? What reductions are needed to help contribute to reaching the 2030 clean air standards in the Ambient Air Quality Directive? And what are the next steps and opportunities for emission reduction? Also, how health organizations, health representatives, and civil society more at large can actually help in furthering and in achieving emission reductions. A short point on housekeeping before we start. You all have the opportunity to ask questions to our speakers, and this will be done in the Q&A. So if you go to the bottom of your screen, you can see there is a Q&A box, and you please do type in your questions, also your comments here. You will not have the opportunity to use your microphone and your camera, but please do share your thoughts in the Q&A, and then we will bring this up in the discussion. So we have 4 presentations, and then we do want to take some time at the end also for then sharing and seeing about your questions. And this webinar will be recorded, so you can also watch it and share within your networks afterwards. And with that, I'm pleased to welcome the first of our key 4 distinguished speakers, which is Bettina Kretschmer. She is a team leader on the National Emission Reduction Commitment Directive at DG Environment in the Clean Air and Urban Policy Unit. And Bettina, you'll present to us on the results of the review. Welcome, and the floor is yours.
Thanks a lot, Anne, for having me at this webinar. I'm going to share my slides.
Indeed. Yeah. Yes, we can see them.
Yeah.
Yeah.
All right. Thanks for having me to this webinar to present the results of the evaluation that we have indeed just concluded. It will be a bit of a tour de force because, as you may see, if you go to the documents, I think we've produced around 500 pages, and it will be a challenge to get this all into 10 minutes, so bear with me, but I'm trying to make that as comprehensible as possible. However, before getting into the results and of our analysis, I just want to take a step back, and Anne already alluded to this. Why do we actually target air pollution in EU legislation? Clearly, because they are and they have been considerable health impacts. Air pollution is the #1 environmental cause of negative health impacts in the EU still, and environmental impacts as well. We have seen significant progress over time, yet the health impacts are still remain significant to this year, or to the year for which we have data available. The latest figures were just published by the European Environmental Agency for the year 2023, showing that still around 180,000 premature deaths are attributable to fine particulate matter in the EU. We have in the EU a clean air policy framework that basically constitutes of 3 pillars, as we like to call them. And already alluded to the fact that the first webinar in the series targeted on the Ambient Air Quality Directive, which sets out air quality standards that are valid throughout the EU's territory. The 2024 revision introduced stricter air quality standards that are more closely aligned with the recommendations or with the guidelines of the World Health Organization that were published in 2021. And then we are addressing emissions, which are, is of course the way of achieving cleaner air ultimately. And to address emissions, we have on the one hand the National Emission Reduction Commitments Directive. This sets out reduction commitments for the 27 member states. They have nationally differentiated reduction commitments for 5 main air pollutants that are the main contributors to health and environmental impacts. You see them listed on the slide: sulfur dioxide, nitrogen oxides, non-methane, volatile organic compounds, fine particulate matter, and ammonia. But another very important part of the Clean Air Policy Framework is source legislation. So source-specific emission standards that we have across a range of EU legislation addressing different sources, such as industrial emissions, through the Industrial Emissions Directive, Eco-Design Directive on appliances, Euro and fuel standards to address emissions from transport. And of course, the whole climate and energy acquis contributes to reducing emissions of air pollutants as well. Now, with that, I'll take you through the evaluation of the NEC directive. We've done this based on a legal obligation to do so, which is enshrined in the directive. So according to Article 13 of the directive, the Commission has the obligation to review the directive by the end of this year. And this directive, this article in the directive already points out a few things that we should be looking at in the evaluation, or that now I should be speaking about the past that we haven't looked at. So that considers scientific and technical progress that has been seen over the evaluation period, but also the advancement of climate and energy policies that we have in the EU. There's a specific focus on ammonia as well. And finally, we also looked at methane, because while methane is not included in the NEC directive, the Commission at the time had proposed emission reduction commitments for methane. However, these were not maintained by the co-legislators and therefore are not included in the directive approved in 2016. However, the Commission reiterated its commitment to look into this issue more closely in the evaluation. Now, we've done this evaluation on the basis of the so-called better regulation guidelines that guide all our impact assessment and the backward-looking evaluation work at EU level. This sets out 5 criteria against which existing legislation is being assessed. And I'll take you through these 5 criteria. Now, the first one is, has the intervention been effective? Has the directive been effective in meeting its objectives? And the first obvious thing to look at is, of course, the evolution of emissions over the period. This graph here starts with the year 2005 because the NEC directive basically sets out national reduction commitments as percentages compared to the base year of 2005. And you see here that all of the pollutants addressed by reduction commitments have decreased. However, they have done so at pretty different pace. The lower line, this is sulfur dioxide. There we have seen a reduction of 85%. And on the other hand, we see a reduction of only 17% for ammonia emissions. Now, this also reflects the different ambition levels. When you look at the reduction commitments in the directive, you'll see that they are least ambitious for ammonia and most ambitious for sulfur dioxide. Over the same period, we have seen an increase in EU's GDP of 46%. So that means that decoupling is taking place between emissions and economic growth. We have those graphs for all of the 5 pollutants. However, given the limited time I have, I just wanted to highlight 2 of them. These are graphs that have been done by the European Environment Agency. All this, I should also say, is based on data that member states submit. So emission estimates for the different pollutants that member states submit to the Commission and the European Agency on a yearly basis. And I just wanted to focus on the 2 pollutants that actually Anne mentioned in her introduction. This is ammonia, which, as I have mentioned, has reduced least. We see that ammonia is mainly the result of agricultural activities to over 90%. Another example, PM2.5 emissions. In the year 2023, 63% of those emissions came from the so-called residential, commercial, institutional sector. A simpler word for that is residential heating. This is mainly residential heating. We see that, emissions have decreased. I think it's by just over 30% over the period looked at here. However, what remains is that the residential sector has been and continues to be the most dominant source sector. Now, another criterion to assess the effectiveness of the directive is, of course, to look at whether member states are on track to meet their reduction commitments. And here we see that the situation over the short period that we had available to assess, and I should say that while the directive was agreed in 2016, the newly agreed reduction commitments applied as of the year 2020. So since 2020, we have seen a progress, we have seen a reduction in the number of non-compliant member states. You see here that for the year 2020, there were 11 instances where the ammonia emission reduction commitments has not been complied with, so 11 member states not meeting their ammonia reduction commitments, and less for the other pollutants. In total, there were 19 non-compliance cases. We are down to 9 non-compliance cases in the year 2023. This is the year for which we have the latest data available. Still, ammonia is the pollutant for which we see most non-compliances, so 5 member states. And for all of the others, it's 1 member state each that is in non-compliance. When we look, however, at the period towards 2030, and we're doing this because the NEC directive also has a set of more ambitious reduction commitments that will apply as of the year 2030. There we see that while ammonia is likely to remain an issue, more needs to be done to reduce other pollutants as well, notably NOx emissions, PM2.5, and to a bit lesser extent, non-methane volatile organic compounds. So the graph on the right, which again is taken from partly from an EA publication, shows the current performance. This is always the first bar, and the, let's say, future performance. So here we have looked at current emissions from member states compared to the more ambitious reduction commitments that will apply as of 2030, showing you that more needs to be done to meet those commitments. Now, the second criterion we have looked at is whether the NEC directive is coherent in the wider policy framework. And what we have found is that overall, there is rather good coherence between the NEC directive and other policies, with some room for improvement. Now, I'm going to talk about a few things here energy sector. Solid biomass fuel use, that includes both coal and biomass wood. So it should read really solid fuel use in small domestic inefficient heaters has a significant impact on air pollution, air quality. So this is something that has been identified as an incoherence. We have also seen potential to further improve coherence. So that could be in the area of climate, where there's scope to further integrate the national plans and programs that are prepared by member states under both clean air and energy and climate policies, to make sure that we address any trade-offs. I mean, I just mentioned one, the use of biomass in small inefficient appliances, and to increase the synergies across the policies. Then agriculture, of course, is another case in point. More can be done to improve farmers' uptake of funding opportunities under the Common Agricultural Policy and of the voluntary measures to bring down ammonia emissions. We will also, of course, look closely at developments under the Industrial Emissions Directive. There, the Commission has planned for 2026 an assessment on the need for union action to address emissions from rearing livestock, in particular from cattle, which again is an important source of ammonia emissions. Finally, when it comes to coherence with the AQD, with the Ambient Air Quality Directive, I mean, coherence is by design good. However, the NEC directive only covers a subset of ozone precursors, and methane is not covered as part of it. Going to the next criterion on efficiency. Efficiency has several aspects, and there's a very long chapter in the evaluation report. I'm going to focus on the high-level messages here, which is one that the benefits from the NEC directive in terms of reducing air pollution, which has immediate benefits for citizens in terms of improved health. It increases workforce productivity. It increases agricultural yields. All these benefits quantified over the evaluation period by far outweigh the abatement costs, or really any costs that we associate with clean air policies. Now, I should say that the figures presented here on the upper part of the graph are the impact of all policies that affect air quality combined, because it was not possible to single out the effect of the NEC on its own. As I mentioned before, we have a coherent set of policies that address air pollution, and this is the combined effect that you see. Now, there are also administrative costs that we looked into, but these are really extremely limited compared to the abatement costs, and, well, again, the benefits by far outweigh the sum of all these cost categories. Leading me to the next evaluation criterion, which is, has the directive provided EU added value? Clearly, our conclusion has been that it has done so. And I'll take you sort of through the three main areas of where we see EU added value. And this, of course, links very closely to the efficiency analysis that we have done. It has provided added value to citizens through reduced health impacts, while it is also noted that inequality in terms of exposure to polluted air remains in the EU, unfortunately. It has provided added value in protecting ecosystems. Acidification has reduced a lot since 2005. This is mainly due also to the reductions that we have seen in sulfur dioxide emissions. However, eutrophication, which is very much linked also to ammonia emissions, has reduced much less. And you may know that the EU is still not on track towards meeting the zero pollution target that is linked to ecosystems, which is defined on eutrophication impacts. Ground level ozone impacts is another environmental impact affecting crop productivity, affecting forest health. Here, it's clear that ozone concentrations fluctuate a lot from year to year. However, there is some improvement over time that can be seen in the data. Coming to an economic added value, clearly, as you have seen on the previous slide, given the fact that overall benefits outweigh costs, there is a clear economic added value from the NEC directive. The benefit cost ratio is at least 4:1, and depending on how we value benefits, it can be up to 13:1. The economy benefits through less productivity losses that are associated with the health impacts from air pollution. And what we have also looked at is whether the adjustment costs are in any way excessive for EU businesses, EU industry. And we concluded that this is unlikely the case, because when you look at the main trading partners of the EU, you can see that similar abatement efforts are taking place in other economies as well outside of the EU. Now, the next evaluation criterion is the relevance. And the relevance criterion is really about assessing whether the NEC has managed to achieve the objectives it set out to contribute to. And this is, as I mentioned before, to reduce health impacts, to reduce environmental impacts. It also looks into evolving needs. We have new evidence that has come since 2016. The World Health Organization has published its 2021 air quality guidelines, showing that air pollution harms human health at even lower levels than thought previously. We have now more stringent air quality standards, and in 2021, the Commission published the Zero Pollution Action Plan, which has 2 air pollution-related targets. What we see is that while, based on new evidence, based on new strategies and new legislation, there's a clear case, of course, for still having the NEC directive that keeps in check national emissions. What we also see, however, is that compliance with the 2030 and beyond ERCs is insufficient to meet both zero pollution targets. The premature death-related target is achieved and is likely to continue to be achieved by 2030. However, the ecosystem-related target is not on track. Also, meeting the more ambitious ERCs is likely to be insufficient to meet the more ambitious air quality limits for fine particulate matter everywhere in the EU, or even to ensure that air quality everywhere in the EU is in line with the more stringent WHO guideline levels. So that leads me to the key messages. Just in short, what have we learned from this evaluation? Now, first of all, the benefits by far outweigh the costs. The second key message is that the NEC directive works. It works on its own, and it works in synergy with other EU policies. But at the same time, we should not be complacent. More needs to be done. We are not quite there yet when it comes to the more ambitious 2030 reduction commitments or to meeting the revised air quality standards of the AQD. In terms of follow-up, our key focus will be on continuing to implement the directive. It's still a relatively young piece of legislation. It was adopted in 2016, and we have already enshrined in the directive the vision for 2030 and beyond. So we focus on implementation for now. At the same time, the revision of the Gothenburg Protocol, which is the international counterpart, so to say, to the NEC directive, is ongoing. And as another follow-up item, we have identified some opportunities where we can streamline implementation by making it easier for member states to report on certain items. And this is also something that we will look at in the coming months and years. Thank you very much.
Thank you very much, Bettina. We do appreciate that you have given us here the summary of the findings of the review. And yeah, I especially like your key messages slide here at the end. And the review has clearly found, and you have highlighted that the NEC directive has worked. It has provided the added value, and I think these are very powerful messages, especially with the finding on the ratio of the benefits that we've had high benefits, but at the same time you highlighted well the homework that's still ahead of us, both for the member states, but also in terms of your next steps for the Commission. So I think this is a very good basis for the further presentations, which are going to be around the challenges that were also highlighted. So I'm pleased to give the floor to our next speaker, Margarita Tolotto. Margarita is Policy Manager for Air and Noise at the European Environmental Bureau, EEB. And you're going to talk about the need to reduce ammonia emissions. The floor is yours. Welcome again.
Thank you, Anne. Thank you for the invitation. I'm really happy to have this chance to comment. To share also some comments, especially given that the Cotonou Protocol revision process is indeed ongoing, and a key meeting happened this week with not much positive outcomes, I would say, but we can speak later. So just a quick overview, but I will skip it. I think there are more interesting things to share. Key facts: when we speak about agriculture, it's important, by ammonia, it's important to recognize the role that agriculture plays, being the contributor of at least 90% of ammonia emissions in the EU. And this brings together their clear implications on the concentrations and emissions of PM2.5, which in the EU is generated by ammonia-related emissions for around 50%, 30% in the US, just to give a relative comparison number. Ammonia is not only responsible for generating PM2.5, which has great health impacts, unfortunately, but also responsible for damaging ecosystems through acidification and eutrophication. Key information: ammonia is indeed covered by the NECD directive, but emissions are decreasing very slowly in many EU member states. And since 2005, in some cases, they have even increased despite the NECD directive requirements and obligation of reductions. This brings us to a very clear case where action is to be prioritized given its health, environmental, and economic impacts, because emissions of ammonia also mean loss of reactive nitrogen, which is a key ingredient, so to say, for today's agriculture. If it's not there, it's created chemically, so it's like losing something and you create it in the laboratory later, when you could actually try to use what nature already offers. Need to act, therefore. Cleaner Outlook 4 is as well one requirement that has been established by the existing NEC directive, and it gives us the opportunity to have a wide understanding around air quality in the EU. So not only the NEC directive, but also how it relates to the AQD obligations and the source policy legislation role. The latest Cleaner Outlook says that the existing package of legislation will only take us at minus 11% of ammonia emissions by 2030, which is not enough. And the maximum technically feasible scenario shows that there is a potential for reducing by 23% by 2030 and 27% by 2050, compared to 2005 levels. Unfortunately, the revised IED does not help. There is no significant increase in coverage and stringency, and this is the Cleaner Outlook specific. And unfortunately, we are now faced with another challenge, which is called Environment Omnibus, might be in your radar as well. It has been published yesterday, and it does contain big challenges for the survival of the existing industrial emissions directive, and therefore leaves little hope for improvements. So we are grateful that the Commission is going to work on this report on how to include El Cato, but we also hope they will make good use of it and identify through the health and environment arguments a need for action, and therefore not shrink the scope of work of the IED, but expand it, including capital and actions which are needed to reduce their emission, this industrial sector emissions. Other new environmental policies for agriculture are also scarce. That's as well the Cleaner Outlook. So it's an official document. It's not us. I was glad to see that this slide was also in Bettina's presentation. I think is offering a very nice understanding and useful picture about how things are going in the EU. The blue line is the ammonia emissions within the EU 27 in the past years. As you can see, it is a quite stable line, unfortunately. with very little improvements in time. I would also like to flag the dot line, which is related to the GDP of the EU, meaning that the economic, let's say, excuse for not acting to protect competitiveness and industrial sector is not something which should be disseminated so strongly, given that the Commission work itself is clarifying that GDP is actually increasing and quite a lot. So the protection and the focus should be on health and environment and European citizens overall, not only on competitiveness. This is another interesting table that is included this time in the NEC directive evaluation. It offers a very clear understanding about what needs to gather legislators' attention in terms of further action. As you can see, the first column is ammonia, showing that between 2025 and 2030, the level of non-compliance, the number of member states which are going to be in non-compliance is actually increasing in time. Therefore, they are not only some of them have missed the 2020 objective, but they are also not going back into compliance, meaning not taking enough efforts to deliver on their 2030 emission reduction commitment, which has been agreed in 2016 NEC directive through a co-negotiation process where member states themselves have also had the possibility to propose their own numbers for reduction. So this was something that member states has agreed on, they committed to. I would like to highlight another part of this evaluation paper, which is really, really interesting. And if it's true, it's really big, but there is a very nice also executive summary that you can look at. The reference to the CIP, I think it's quite misleading, as those numbers are clearly showing that the CIP source policy is not helping us or helping the EU in delivering on the ammonia reduction. But the paper says that the CAP has built-in coherence with the NEC directive. That sounds a bit too much. And also the potential to reduce ammonia emissions is thus significant. Unfortunately, the potential does not mean the result. And this is mainly related to the fact that the CAP does not have specific targets for air quality and ammonia emission reduction. There is the obligation to uptake measures at farm level which deliver on ammonia emissions, but there is no obligation of results, and there is no indicator to check how these and if these have happened. Therefore, things are, let's say, happening in a kind of wild way. And we can see this from the member states' inventories themselves. Another important point of the NEC evaluation paper is the costs line, which is indeed, Bettina has rightly referred to the 4, which is the at least 4 times the cost of the benefits are at least 4 times higher than the cost of the implementation of the measure. But the paper, especially the summary, gives you another figure which says between 4 to 13 times higher than the cost of implementation. Therefore, there is not only a health and environmental protection case that we need to look at, but there is also a very strong economic case for promoting action in delivering on air quality. I would like to flag, and I refer to this when identifying the potential for reduction by 2030, to the limits of the maximum technically feasible reduction scenario on which these obligations of results are based. Those are scenarios which are built considering what could be the reductions that member states and the EU can achieve if all the available technical measures are implemented, but those are only end-of-pipe solutions. So there is nothing which is looking, sorry, there is nothing which has looked at, sorry, no. Oh my gosh. Sorry. Nothing.
Sorry about this. I hope it's okay again.
Yes, I hope so. I'm not feeling very well. Nothing has looked at the non-technical measures and behavioral changes and their impact on the potential to reduce. This is a big gap in the analysis. Voilà. Sorry. I think it's better, yeah. One slide on the Gothenburg Protocol that I've mentioned at the beginning. A key meeting happened this week. Unfortunately, the EU and its member states were not positioning themselves in an ambitious way. There was not the expected commitment to further promote action on ammonia and on methane, especially with the clear commitment to include methane in the Gothenburg Protocol. And this is not helpful for the future. Sorry, I will leave the slides with you, Anne, if that's okay. That was my last one in any case. It's getting very difficult.
Yes, thank you. Thank you so much, Margot, for presenting to us despite not feeling well. We do appreciate it. And on agriculture, I think we could spend a whole nother webinar, actually a day, on talking about it and talking about the challenges. We don't have time for that, but I think there's certainly a lot of need, and actually there is a lot of potential for achieving actually health promoting agricultural system through the right policy framework. So and thank you very much for highlighting the challenges there. And one of the key messages I took away from your presentation was really the clear economic case in showing that the emissions are decoupled from economic growth, because I think that's unfortunately very much a thinking that's moving in this direction again, that for competitiveness, for economic prosperity, we cannot be at the same time as ambitious on emissions reductions as we need to be. And there is no contradiction between those two things. From our case, actually, we would argue that they need to go hand in hand and together. But indeed, yes, further topics or topics for further webinar. We are now moving on in our presentations because we have two more presenters. So I'm pleased to welcome and give the floor to Ebba Malmqvist. She is Associate Professor at Lund University and air pollution expert at AirClim. And Ebba, you're going to talk to us about methane emissions and ozone. The floor is yours.
Thank you very much, Anne. And I hope you can see my slides.
Yes, we can see them. Thank you.
Perfect. So I will talk about why mandatory reduction of methane emission is needed for reducing the formation of tropospheric ozone. So let's see. So as you all know here, ozone is good up high and bad nearby where we are breathing. So we need it up, but we don't want it down here in our troposphere. And recent analysis using satellite imaging of our daily ozone concentration over 2023 shows what we could assume. Ozone levels are normally quite low in the winter time, and then they are high in summer, especially in the Southern Europe region. What has become more increasing is that ozone levels can also be high in very northern regions of Europe, such as in Iceland, northern Finland, Sweden, and Norway. We could also get these ozone episodes that was not present before. And looking at ozone pollution, it's also called, we can say it's a butterfly effect. So if you have a high concentration resulting from local and very global sources of precursors, we can see high peaks of ozone. And this is a busy picture showing how ozone is formed. So ozone is formed by volatile organic compounds and NOx in the presence of sun radiation, and also by a VOC called methane. And we know that some of these precursors are staying longer in the troposphere and some are staying shorter. And methane, it can be staying in our troposphere for about 10-20 years. So they can be very important. And we know now, with increasing evidence, that methane emission stands for up to 37% of the ozone background levels in Europe. So if we don't do anything about methane, it will be very hard to get to healthy levels of ozone, especially in a changing climate. And this is a busy picture too, but so the orange is the ozone peak season levels in the orange one, and then you can see that with current legislation, so we have the light blue is the rest of the world, and the dark blue is in the EMIC region. We can see that we need to do something both when it comes to not reducing NOx, CO, and non-methane volatile organic compounds. But to really get there, we also need to do something in our and the rest of the world related to methane emission. And to really get into more healthier levels, we need to do something which is, so CLE is current legislation, and MRFR is maximum feasible reduction, and as Margie said, only the technical ones. So it means that if you look at the green and the purple ones, so we can say that we can reduce about 1/3 with measures here in the European regions, and we can reduce about 1/3 with NOx and VOC reduction in the rest of the world, and it's the same with methane. We need to do something here, and we need to do it on a global level, but we also need to do it here. And ozone is harmful, we all know that. Plants are very sensitive, and we can see how it's easier to look at the plants to see how ozone is damaging. It's like bleaching or start stiffling of the leaves. So it's some kind of oxidation. And if we look at the regions that are if we get to levels that are sensitive for crops, so that is AOT about 40, and that is per billion. But if you compare that to what we normally, it's about 80 micrograms per cubic meter ozone levels. So we can see that there are some regions, especially in Southern Europe, where crops will be affected, and also our forests will be affected or are affected by ozone levels, and that we really need to act. There are also new research coming out how ozone is also impacting the pollination of plants because it degrades the floral scent. And for health, the latest US EPA workshop on ozone, so there's emerging research findings, including impacts on the brain. We know more and more about the studies on COPD and respiratory diseases, and we can see in short-term studies that there doesn't seem to be any strong thresholds or safe levels. We need to reduce it. In recent meta-analysis also on the long-term exposure to ozone, we can see that annual ozone is now strongly linked to mortality from respiratory diseases. And in the very recent published RAPI report, we can also see that ozone is likely to be causal, which is quite strong, also very strong causality for the respiratory mortality with ozone. And we have the premature death for ozone has been calculated by the European Environment Agency, and we can see that it is higher in the southern parts of Europe. And there is also a link between ozone and a changing climate. And we know that if climate change increases, we will also have larger episodes of ozone, meaning that we have to do something both on climate and air pollution control. Otherwise, we are estimating more mortality per ozone. And with that, I would like to thank you for listening.
Thank you very much, Ebba, for your presentation on giving us the latest evidence on the health impact of ozone and also really making clear the interlinkages, both when it comes to emission reductions, that emission reductions need to happen in the EU, in Europe, but also globally, and then also the interlinkages indeed with climate change. And we also know and have more and more evidence on the interlinkage between when it comes to premature deaths from heat exposure in the summer, heat and ozone exposure in the summer, which is of key concern. Indeed, and so much more time we would need to be talking about that. So thank you again. We're now moving to our last speaker, last but not least, is Torben Sigsgaard. Torben is an professor at the Department of Public Health at the Institute of Environmental and Occupational Medicine at Aarhus University, and also a member of the an expert at the European Respiratory Society. And you are going to talk about the health effects of wood smoke, as we heard that biomass burning, the PM emissions from biomass burning are a key concern. So Torben, welcome, and the floor is yours.
Thank you, Anna, and welcome to everybody. I'm going to talk about health effects more than the economic cost of it, but of course there's an economic toll. But I will start with wood smoke. It's a very old way of heating houses, and it's a part of the air pollution that we are having around. I can't change it. I have to find out what to do.
Indeed, we only see your opening slide.
Now it's coming.
Yes, now we see,
Yeah.
yes. Mm-hmm.
Okay, but the target organ for air pollution is primarily the lungs, and the lungs look like a tree. We just have to turn it around, and then you have the lungs with the trunk of the tree, like the trachea and the bronchi, and then the leaves are the place where air exchange is happening deep inside the lungs. Because of the very narrow difference between the air and the blood here, we have the exchange of O2, which we want to have. O2 and CO2 has to be exchanged, but also pollutants are coming down in that area and are leaking over to the cardiovascular system. But let's take a tour into the lung and the airways. We have the trachea that we are passing, and then the air is coming down to the trachea and to the two main bronchi, dividing into the lungs, the left and the right. And in the bottom, you see the exchange place, the alveoli here. And here you can see that there's a stack of red blood cells being changed for CO2 for ozone. So it comes out into the whole body from there, and then it enters the different organs. And if you look at the particles that we're talking about today, this is soot particles coming from residential wood smoke, and it's not very big. It's around 1 micron, this size. So it's what we call fine particulates that are causing exposure of the deeper airways in the lung. And here we have a defense system. We call it the mucociliary escalator, because it takes the mucus up into the pharynx, where you can cough it up and then you can swallow it. And if you look at these cilia, you can see how they are working like seaweed, and this is the mucus coming upwards towards the pharynx. But if it passes that area with these cilia, it comes down to the airways where there are no cilia, but we have another defense system here called the macrophages, or I call them scavenger cells. They're residing in this area, and if they find something, they engulf it and try to degrade it by enzymes, like the enzymes you know from washing powder. And here you see, this is where the capillary are, and here you have the air. And if you make that bigger, you can see that here you see the stacked red blood cells that are going into this airway. And here you can also see that it's a very, very narrow difference you have between air and the blood, which means that CO2 and O2 can be exchanged, but also air pollutants can leak from that into the bloodstream, and that causes oxidative stress, immune effects, and also some genetic regulation effects in the lung, but also in other organs, because they are triggered by this oxidative stress that's released into the blood. So we see effects in the, I would say, the normal suspects in the heart and in the lung, but we also see it in a lot of other organs. Sorry for the Danish, but we see it in the liver, in fat, in stomach and gut, in the pancreas, and in the kidney and bladder and skin, and even in bones and tendons, and even before you get born, you are exposed via your mother's womb, because there's a barrier that all these small particles can pass. And then finally, we have the nose, where we have this is the olfactory nerve, where you smell things. But the problem is that these nerve endings are going through the skull, and this makes a leak for very fine particles who can enter directly into the brain liquid from the top of the nose. We know that 2 to 3 million children die every year because of lung infections that are really caused by exposure to what you see here, namely wood smoke in domestic heating and cooking in third world countries. But what about Europe then? If you look at the curves about this, this is where you see exposures in Africa and East Asia. And here you see exposures in Europe that we see in indoor environments. So we have the household air pollution, secondary hand smoking, and ambient air pollution. And here we're down to ambient air pollution, which is containing wood smoke. And here, this is a study from EHP, where McIntyre and his colleagues, they tried to look at what about these children's cohort we have in Europe, Ramsar and Pyama and whatever they're called. And you can see the effect of PM 2.5, these small particles from wood smoke. And you can see that the meta-analysis shows that there's a 2.6 increase in the risk of having early childhood respiratory infections. And the same if you look at the absorbance. The absorbance is relevant because this is a reflection of the directly exposed, emitted particles in the country. So these are the ones that you can actually avoid by doing something. The first study, the Sentinel study on air pollution and health, was a 6-city study, now called the 6-city study from Harvard, because they showed that there was a difference between the mortality in groups of people from 6 different places in US, and they were in a range with the rural area in Portage to Topeka, and then some suburban areas in Watertown, St. Louis, and Harriman, and finally a very heavy industry area, Steubenville, Ohio. And what you can see here is that the higher the exposure is to particulates, this is 35 microgram per meter cube, the higher the relative risk of dying too early in this study where they were the first to be able to take care or take into account personal behavior like smoking and eating, which was a critique that was raised to earlier studies. So this study really emphasized the PM2.5 as a problem and also showed that there was this effect of PM2.5, and also of PM10. So a study from my colleagues in Copenhagen looking at biomass and secondary particles showed that for cardiovascular diseases, there was an increase the same day as the exposure was high, and then kind of faded out during the week. And for the secondary particles, and these are also interesting because they are made in the atmosphere with biomass as a precursor. So we see these effects of the secondary particles and the directly emitted biomass particles on cardiovascular disease, but we also see it for COPD, where there's an increase in hospital admissions the days after, actually more days after one episode of a high biomass burning. For asthma, it seems a bit, it's not predictable as the same as the others, because it's not the reason for the coming to this thing. We also looked at the health impacts of biomass burning in 4 Nordic places, namely Umeå in northern Sweden, Helsinki in Finland, Oslo in Norway, and Copenhagen in Denmark. And what we saw here is that the number of premature death was reflecting both the number of people living there, but also the exposure to wood smoke. And in this study, we concluded that 414 too early deaths are happening every year in these 4 cities alone, and totally we lose a little more than 4,000 life year every year due to biomass burning in this area. And in Hobart in Tasmania, they tried to do an intervention. They banned burning overnight in Launceston in 2001. And then they looked at the years before, from 1994 to 2001, and then the years after this intervention, showing that this is the 75% highest concentration of PM10. It was in this, so it's around 30 after and around 40 before. So they saw a decrease in the exposure. And they also saw a decrease in mortality. So what they concluded was that the respiratory disease dropped by 28%, and what I couldn't see my own slide, but the cardiovascular diseases decreased even more. So we made an ERS position paper some years ago about this wood smoke. And the conclusion at that time was that the yearly premature deaths in Europe because of wood smoke or biomass burning at home is around 400,000. So there's really a place for gaining some lives by decreasing the exposure from biomass burning. Thank you.
Thank you very much, Torben, for giving us the evidence and the data on the health impacts of biomass burning. And also, I really liked your visualizations in the beginning, which show us again what we're talking about when we're saying air pollution is the largest environmental threat to health. It's very impressive. We are at the end of our presentations. I did want to ask a short question to all our panelists, because I wouldn't want to leave us at the end of this webinar just thinking about the challenges that are very great ahead. So I do want to ask each one of you what now needs to happen. If you could take the other way around. So Torben, first, in terms of how for reducing the health impacts of biomass burning, what needs to happen? If you could have a very short answer, please.
I've been trying to say that for many years. We have to stop burning in near cities, because there's a clear correlation between the number of deaths and the number of people exposed. So we have to get it out of the cities to start with, and then we have to ban it fully later on, because it's also a climate problem that we have all this biomass burning. So we can,
Thank you very much.
do something for ourselves and for the climate at the same time.
Thank you. And Ebba, in terms of ozone, is the answer legislation for legally binding ozone limit values?
Yes, that would have been good. But in that conversation, they said it's hard because we also need to capture transboundary precursors of ozone. So we were hoping for more action in the NEC directive or in the Gothenburg protocol, where we could capture some of those precursors. And also then we need to include methane, as it's becoming also a more and more important precursor. And we need to act now, because the number of deaths otherwise will increase because of climate change.
Thank you. Margarita, if you can speak again, checking with you. Indeed, you showed that unfortunately ammonia emissions are not going down. So what needs to happen?
I think it's key that the industrial agricultural sector, meaning the super polluters, super emitters of ammonia emissions in Europe, which are clearly identifiable, are finally treated as industrial plants and are complying with legislation accordingly, as it is the case also for us, for other type of industries, but not for agricultural industries. Yes, safeguarding small and micro farms.
Mm-hmm. Thank you. And last but not least, Bettina, you highlighted that indeed member states, there are challenges with member states reaching their obligations for 2030. So what needs to happen, and how is the Commission supporting member states and nudging them also to strengthen emission reductions?
Yeah, thank you. I mean, I think the legally binding reduction commitments we have is the first nudge in a way, right? I mean, and in terms of when it comes to supporting member states, we have a lot of EU funding available for, clean air related. I mean, it's estimated that over the period to 2026, it could amount up to 185 billion of funding that has some clean air relevance. So there is a lot that member states can tap into there. And maybe more concretely from our side, I mean, we are, trying to disseminate good practice by getting member states together and helping them to exchange on successful measures to reduce emissions.
Thank you very much. And actually, that's also a very good prompt for a further webinar, talking about what good practice and encouraging then leadership on air quality, on clean air, reducing emissions, but also on the funding aspect, which are key. I would very much like to thank our four presenters really for your excellent and rich presentations. I would like to thank all participants. This webinar has been recorded, so please have a look on HEAL's YouTube channel and share it in your networks. And then I wish everyone a good end of the year and some relaxing holidays, and look forward to continuing the conversation on clean air for health in the new year. Thank you.